I'm not going to do now the right towels, and I'm not going to do the whole preparation. Why? I need to focus now into a specific learning skill that I want you to do, so forgive me, okay? Towel is not right, no underneath, no support, but the focus that we need to, what I want to focus now is about how to increase relaxation, how to maximize relaxation, really. How to help the client to relax quicker. So, you know, we learn the effleurage and pétrissage, and you can do it better, but there are certain techniques or areas that you want to concentrate to make the client relax deeper. And these areas are the face, head, scalp, palm, and feet. And why is it? They're having a lot of nerves. So your nerves in your hands and feet are very sensitive. Yeah? So you can tap into it and help them to relax more. Face and head as well, very sensitive, and you can help them to relax quicker. There is a concept in physiology that's called the homonculus. If someone have heard about homonculus?
Yeah.
The little man inside the brain. Okay, imagine that it's a man that looks like with big hands, big feet, big face, and huge lips and tongue. Why this man looks so funny? Because every area that is more sensitive would look bigger. So these are the sensitive areas of our body. And in a way, these are the extremities, you know. We feel with our hands, we step on the ground with our feet, and we taste from the mouth and lips. So this area needs to be sensitive. And we can help with massage by, in a way, touching more when you touch their hands rather than the back. So it's a different concept. I will call this concept massage according to the homunculus. And if you ever want a little bit more information, then email me and I'll help you with. Okay? Now I'm going to concentrate with head and face. However, I'll tell you right away, it's like New York. Other people hate it or love it. People don't say about New York, it's all right. Yes, they either excited about it or they completely don't like it. So face, some people love it, some feel too sensitive about it, yeah? So let's see and start. First of all, have we done some technique sitting?
Yeah.
Okay, we did. All right, good. Maybe we did neck and shoulder or sitting, yeah? Oh, all right.
On my head.
Okay, good, all right. Good. So, first of all, when you're trying to relax someone, I'll explain it differently. If they relax, how would they feel? They feel their weight surrounded to the table or opposite? They would feel surrounded to the table, right? Kind of heavy. So when you relax, you feel heavy. Yeah? So in a way, we work on that. We work on this heaviness in the opposite way, in a kind of a reflexive way. So instead of lifting her head, I will actually try to make it heavier by pressing on it. Yeah? And what I do, I try to, in a way, also think about how people relax. They relax and they feel secure, right? So I'll tell myself, let me secure the neck. I'm actually kind of wrap the neck with my hands. Yeah, do you see my fingers on the other side? So I wrap the neck, and in a way, I tell the neck, you're secure now, you can relax. And now I press on the head. But I don't press really fast, I press really slow. It's almost like, you know, when somebody's, how do you call this sidekick? What do? They the hypnotize, yes? So they count to 10, and by 10 you're gone. You're trying to do that for the head. You're trying to slowly press. So you start here and you press 1, 2, 3, 4, 5, 6, and so, and then you get into 10, and then you wait there for 10 counts, and then slowly you go back 10 counts up. What it does, it sends the nervous system into a different rhythm. Yeah. So you need to be quite supportive on yourself, and then once you're ready, you create a contact, and then very slowly you start 1, 2, 3. You increase the pressure. 7, 8, 9. If you now start to move, it would be kind of a disaster. So you have to be really quiet within yourself, almost empty. And then wait there. And the nervous system starts feeling more supported, so it just let go. And then you go upward, 2, 3. Don't rush it. 5, 6, 7, 8, 9, 10. Work very slow, very supportive. Then you can do the same thing, but with a very minimal movement to the right and to the left. That's it, really. It requires a lot of patience from your end to do it very slow, very smooth, and just really deeply support their neck and shoulder and head. And if you do that, you can send the whole person into just, it's almost like a submarine. You just go down and then you stay there. Yeah? So someone who needs a quick relaxation, you can do that, and they would feel kind of very deep right away. Yeah? How was it?
Yeah, good.
Yeah.
Kind of weird to begin with.
It's weird, isn't
But
it?
it's good though.
Yeah. Okay. So I'll go around and help you with that. Right. Second, you can come into sitting, and you can start with the face. The face, really, I would work on areas. So there is the forehead. Yeah. Around the eyes, you're not going to do much. Around the cheek, you can do a lot because you have a lot of muscles. The cheeks, actually, whoever laughs so much that the cheek hurts? Yeah. So the cheek has all these muscles that coming from the mouth and from here and from above and below. So it's nice to work on the cheeks where the bone is. Do you feel the bone? Do you feel that? The cheekbones, yeah? So work around that. It's all muscles. Now this muscle attached to the face, to the skin, but also to the cheekbone. Okay? Then you can work on the cheek to the side. You can work on the upper lips, on the upper jaw and the lower jaw. You can go to the side, work on the ears and on the back of the ears, and that's what we're going to do. Okay. There are probably plenty of different ways to work around the face. This is one of. You can start, and by means probably Sally's doing something completely different after, so it's nice to have a variety, but starting with something. Okay. Starting with the forehead, I don't put any oil because actually the face has natural oil. If you need one drop, probably would be enough, but most people are fine without any. And actually quite don't like oily face. So you can start and just really work quite deep onto the side. Sorry?
Like the chocolate bar thing that you do.
Yes, like opening the chocolate bar. Yeah, you can do that. By the way, look that I still use my body, even when I'm sitting. Do you see that? Same posture thing. Same thing. I use my weight. Otherwise, it will become very jerky. And in the face, you cannot afford to be jerky because the whole head would move and you tilt, you're just shaking the brain really. Yeah? You can do it this way or that way. Very slow. You know what? It's almost like, doesn't matter what you do, it's more important how you do it. So I could do that. You think it's going to make any difference? No, it's the quality. And by all means, the face is very, very delicate. You know why? If I start doing things around her eyes, she's not going to like it. She's going to close her energy. If I'm going to move her head, her ears would feel like there is an earthquake. Mm-hmm. She's going to contract the muscle. So you have to, that's why I like to do it sitting. Just sitting and just, it's not so much about really what you do, but how, really. You know? So in a way, do less. You know, you can do it again, do it slow. And I think that this is the difference. You're thinking about, oh, what should I do right? I say, how should I do it right? You know? Okay, you can do on the eyebrows. Okay. Then cup your hand, because you don't want to have flat hands. If you have flat hands, I'm going to touch her eyelashes. And if I do that, again, very uncomfortable, or come from the side. You can come from the side. And really nicely work all these muscles. Good. You can, a nice pressure point is on the side of the nose, especially if you have running nose. Kind of nice, and you can be quite pointy there. And again, slowly. You can clear this up. A nice point is right in between the eyes. So I will come and put 2 fingers here.
Is that on the bridge of the nose or just above it?
It's kind of on the where the tear sac is.
Okay.
Yeah, so it's quite low. Yeah. Coming to the upper lip, upper jaw, I would like you to massage there. And you would be amazed how much tension you can have there. Yeah. This is where all the teeth join the jaw. And from there go to the side. But still look for the bone. It's a bit bizarre to feel it. Go to the bone, feel the teeth attachment to the jaw itself. And then do the same thing onto the lower jaw. It's definitely kind of waking up that area. Yeah. Once you finish, go to the strongest muscle in the body. You know which one is it? Where is Luke?
Masseter.
Masseter. Yeah, the strongest muscle in the body. It can be very tender. So at times, with people clenching their jaws, stress, yeah, it might be even having trigger point. So slowly on that. And to finish, you massaging the ear itself. The ear is like, you know, counting money, this kind of movement. So it's a really nice sensation. Again, to some would love it, really. Good. And then behind the ears, again, very strong bones there behind the ears. You can nicely massage there, where the ears attach on the back into the scalp. Very invigorating. Good. So a revision, okay? Forehead, eyebrows, coming from the side, the cheekbones and all the muscles around, upper jaw, lower jaw, masseter, ears, okay? And now it's really fantastic working on the skull itself. On the skull itself, there is a muscle here. Who remember that muscle? No? Sorry? Occipital, frontalis, and actually temporalis, yes, as well. Temporalis, yeah, great. Good. So, nice way, move it to the side, and really, what you do is like, you know, there is the, it's called racking, when you're taking the grass from raking. Yeah? So, it's kind of friction on the skin a little bit, and really improve the blood circulation. You can do that to the side. You can then turn the head slowly to the other side. Of the same accord, work on the suboccipital area. Yeah, very nice, very tender area. Lots of headaches start from there. Yeah. And working on the back, on the sides. And then really, I really like to finish with something that I'm going to tell you how it's called later. I'll show you how it starts really. It starts something like that. You're taking your forehand, you go and slide all the way to the, until your thumbs attach to the forehead, and then you change position downward toward the massage table until you're reaching the ears, and then you go upward, really squeezing it really, really nice. Yeah, and again, sliding, and then meeting downward, and then gripping your fingers to the back, but don't dig too much. Just make it really nice and smooth. And then going upward. Okay. Now it's your turn, huh? Good. Start slowly with going deep. Take the time, sit, be comfortable, and remember that the quality is more important than what you do.